Hi, I'm Dr. Kriti Lohia, consultant dermatologist, CEO and medical director at Aesthetics Redefined by Cocoona. And today I have Dr. Sanjay Parashar, who is consultant plastic surgeon, co-founder of Aesthetics Redefined by Cocoona. So Dr. Sanjay, I've got a couple of questions for you about hair transplant because you're also a hair transplant expert. The most common myth that people have in their head is that मैंने अगर एक बारी hair transplant किया तो मुझे जिंदगी भर अपने बालों के लिए कुछ और नहीं करना पड़ेगा. What do you have to say to that?
No, you have to understand hair loss is a continuous process. Okay, whether you already have some hair which will eventually fall off,
right,
or the hair that has been transplanted will age at some point of time. Because body is aging, body is not stopping aging.
Very true.
Hair transplant can be a one-time option if your body stops aging, and you can do that. How?
How?
You have to have medical management treatment along with that to improve your quality of your body, of course, and the quality of your scalp as well.
Right.
Which means that it does not mean that if you have had hair transplant, you don't have to do anything. No, you still have to look after that hair. You still have to. I would strongly recommend to continue medical management as well. You know.
Yeah.
For example, vitamin D can be a problem, iron can be a problem. You may still continue to need Minoxidil because it will improve continuously the blood circulation. You know? And the different mechanism that it works for the hair regrowth. Sometimes even hormonal tablets, for example.
Very true.
Or PRP.
Very true.
So yes, of course, as doctors, we try to minimize so you don't have to be dependent on all of those treatments. So we will wisely advise you which type of hair transplant you must do that may last longer, and what type of treatment you do that you don't have to do very frequently and too often for too long.
So would it be okay to say that hair transplant is quite essentially a magic trick? It doesn't cure hair fall or hair loss and hair thinning. What it does is it takes from where you have more and sort of rearranges in a place where you have less. But जहाँ पर वो visible density दिखाई दे रही है, उसका contribution is from existing hair as well as transplanted hair. And those existing hair are still at risk of thinning and aging. And धीरे 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 करके वो transplanted hair भी टाटा बाय बाय बोल देंगे अगर आप उनको maintain नहीं करते हो.
Correct.
तो आपको जो oral चीजें करनी है, topical चीजें करनी है और जो transplanted और existing बाल है, उनके stem cells हैं, उनको support करना है, उसके लिए वो चीज whether you do hair transplant or not, you have to do those things if you want hair. Right?
That's correct. That's
okay.
Correct.
So I think one other confusion that most people have in their head is, how do I decide which hair transplant surgeon is good, which hair transplant surgeon is not good? When are they actually doing what they said they should be doing? So क्या चीज देखनी चाहिए when somebody is considering hair transplant?
देखिए भाई, you have to be smart, okay? Because whatever it is, be it medical management or be it surgical management, it needs a lot of expertise and know-how, which can be only by people who are qualified enough and have enough experience. And among all of that, you also need to understand the safety of the medication, the safety of the treatment, the safety of the hair transplant. So you must look for an experienced doctor, a dermatologist, a plastic surgeon who are qualified and trained and experienced to do your treatment.
Very true. I understand that because FUE is seemingly a simpler procedure, there are a lot of people who are not necessarily qualified to do this, which is why you end up with so many botched up jobs, right?
Yeah.
Failed hair transplants or donor area which is completely destroyed. So there is a lot of confusion about what are good donor areas. So quite essentially, apart from the scalp, Dr. Sanjay, what are the other areas that can be a good donor area for someone and they should be aware about these things?
So obviously scalp is the best, and the best is back of the head, but even side of the scalp you can borrow the hair from. But beard is the next side where the hair thickness is good. It grows to some extent, you know, so that can be used. Or body hair like chest hair, for example. But the body hair other than the neck and face hair are short. They are more curly. So if you are planning to combine, you know, hair from different areas, then you have to strategically plan.
Right.
So it doesn't look awkward.
Right.
So the hair that is borrowed from the back of the head is usually in the front to cover most of the areas, but rest of the hair can be used to just fill up the gap to give that illusion of a fullness.
And whether your hair is straight or curly or very curly or kinky, are you still somebody that you can undergo hair transplant, or is it keep depending upon the straightness or the curliness
Yeah,
you
so
got?
no, it also requires a special expertise to treat hair, particularly which are very curly.
Yeah.
Okay, because the roots are curly.
Yeah.
In a straight hair, the root is straight. So the general conception is if you just go straight, you will be sure that you get the root. But that may not be true in curly hair. People who have a lot of kinky hair. So you need an expertise. You need a person who understands the growth pattern. So they can foresee the root and then accordingly extract the hair.
So in somebody who's got curlier hair, can you still safely do FUE, or would you prefer doing an FUE procedure?
That's a good question. Yeah. Obviously, again, it depends on how much of hair follicles are required. If there is a lot of hair follicle required, then FUT sometimes is a better option because you can actually see the root in FUT and use them wisely, and you don't waste anything.
Right.
But if there is ample amount of donor areas and patient is younger and you have the expertise of treating with kinky hairs, you can do FUA.
Can you combine hair transplant and stem cell treatment for the same patient?
Yes, we do that. We do sometimes PRP at the same time. We can also do nanofactor at the same time. And that helps very well. Sometimes I've done regenera as well, where I feel that the hair may not be strong enough to sustain for long.
And you can even combine your stem cell treatment with signaling molecules like exosomes too.
Oh, I believe exosome is the next thing.
Definitely. Regenerative medicine overall for hair loss and hair thinning is definitely the next thing. And combining that with hair transplant really does give patients the best result. Right. Thank you so much, Dr. Sanjay. This was very enlightening, and you guys can stay tuned for the next round of questions we have on hair transplant.